Breast cancer begins with changes deep inside the body. To understand it, we first need to understand the normal breast. The breast contains fat, connective tissue, milk-producing lobules, ducts, blood vessels, and an important lymphatic network. Milk ducts form a branching network, carrying milk toward the nipple during breastfeeding. Breast cancer can begin silently, but what happens inside your body next may surprise you. Watch until the end to understand the full story, and subscribe for more life-changing health videos. Lobules are specialized structures associated with milk production, surrounded by supporting tissue and a rich blood supply. Lymphatic vessels drain fluid from the breast toward nearby lymph nodes, particularly those located in the armpit. Healthy breast cells grow, divide, perform their functions, and stop multiplying when appropriate. Inside these cells, complex genetic signals carefully regulate growth, division, repair, and normal cellular function. But when genetic changes accumulate, these carefully controlled processes can become disrupted. An abnormal cell may begin behaving differently, multiplying when it should not, and gradually losing normal cellular control. And importantly, early breast cancer may cause no obvious symptoms, making appropriate screening and medical evaluation important. As abnormal cells continue multiplying, they can create an increasingly abnormal area within otherwise healthy breast tissue. Over time, a localized collection of abnormal cells may develop into a tumor. Some breast cancers begin in cells lining the milk ducts, while others begin in different structures within the breast. In ductal carcinoma in situ, or CIS, abnormal cells remain confined inside the milk duct. In invasive breast cancer, cancer cells can move beyond their original location and enter surrounding breast tissue. As a tumor grows, it interacts with surrounding connective tissue, blood vessels, and lymphatic pathways. Growing cancer tissue can interact with nearby blood vessels, providing access to nutrients and oxygen. Cancer cells may also enter lymphatic vessels, creating a possible pathway toward nearby lymph nodes. Nearby lymph nodes can become involved when cancer cells travel through the lymphatic system. However, not every breast lump is cancer. Many breast changes are benign, which is why proper medical evaluation matters. A new lump or mass in the breast is one of the changes that should be evaluated by a healthcare professional. An unusual thick or firm area in or near the breast can also deserve medical attention. Skin dimpling or puckering is another breast change that should not simply be ignored. A newly inverted or noticeably changing nipple can also be a reason to seek medical assessment. Breast swelling can sometimes occur even when no distinct lump can be felt. Breast pain alone does not usually mean cancer, but persistent or concerning symptoms still deserve professional evaluation. If you notice a new or unusual breast change, don't panic, but don't ignore it. Talk with a qualified healthcare professional. Screening aims to find breast cancer before symptoms appear, potentially allowing cancers to be detected earlier. Mammography uses low-dose X-rays to create detailed images of breast tissue. These images can reveal abnormalities that may be difficult to identify through physical examination alone. Breast ultrasound uses sound waves to create images of structures located inside the breast. When imaging identifies an area of concern, doctors may recommend additional tests to understand it more clearly. A diagnostic mammogram can provide additional views, helping specialists examine a suspicious area more closely. Breast MRI uses magnetic fields and radio waves to produce highly detailed images of breast tissue. A clinical breast examination can help identify a lump or other unusual physical change. When necessary, a biopsy removes a small tissue sample so it can be examined in the laboratory. A pathologist studies the tissue under a microscope. A biopsy is used to confirm whether breast cancer is present. Breast cancer is not one single disease. Different types can behave differently and require different treatment approaches. Tumor testing can identify biomarkers such as estrogen receptors, progesterone receptors, and HER2. Tumor grade describes how abnormal the cancer cells appear and provides information about their biological behavior. Staging considers factors including tumor size, lymph node involvement, and whether cancer has spread elsewhere. One possible route of spread is through lymphatic vessels toward nearby lymph nodes. Cancer cells can also enter blood vessels, creating a pathway to distant parts of the body. When breast cancer spreads or metastasizes, the bones can become one possible site of distant disease. Other possible sites include the liver, lungs, brain, and other parts of the body. Metastatic disease can affect the lungs, although the pattern of spread varies from one patient to another. Advanced breast cancer can sometimes spread to the brain, requiring specialized evaluation and treatment. After diagnosis, doctors consider the cancer's type and stage before developing an individualized treatment plan. For some patients, surgery can remove the tumor while preserving as much healthy breast tissue as possible. For others, mastectomy may be recommended, depending on the cancer and the individual's circumstances. Doctors may also examine nearby lymph nodes to determine whether cancer cells have spread beyond the breast. Radiation therapy uses targeted energy to destroy cancer cells in a specific treatment area. Chemotherapy uses medicines that travel throughout the body, but it is not necessary for every breast cancer patient. Depending on tumor biology, targeted medicines or hormone therapy may also become part of treatment. If you found this video helpful, subscribe to the channel and turn on the notification bell so you never miss our next powerful women's health documentary. See you in the next one.